This is Dr. Sonia Dhoot, and you are watching this video because you have been diagnosed with a retinal detachment. A retinal detachment is one of the most serious things that can happen to the eye and requires emergency surgery. The retina is nerve tissue that lines the inner back wall of the eye, kind of like wallpaper. That wallpaper can separate from the back wall of the eye, and this is a condition known as a retinal detachment. Usually what happens is for some reason your retina has a tear, and going undiagnosed, that tear can lead to a retinal detachment. A retinal detachment, depending on how extensive it is, needs surgery somewhere within 24 hours to about a week from diagnosis. The surgery is an outpatient surgery, takes about an hour, but you come into the surgery center, have the surgery, and you go home the same day. We give medication through your IV so that you're sedated and comfortable at the time of surgery. And we also give you numbing medication around the eye so the eye is numb and should be comfortable during the procedure. We make 3 little incisions on the white part of the eye, about the size of the tip of that pen. The first incision is for an infusion cannula that keeps the eye inflated while we work. The second cannula is for a light, so we can get direct visualization of the retina while we work. And the third is the instrument we use to do whatever work we're doing to the retina. The first step in the procedure is removing the vitreous jelly in the back of the eye. As an added bonus, removing this vitreous jelly gets rid of any floaters you have in that eye. The next step is to make a small little hole in the retina itself to drain all of the fluid. We then do laser all the way around the retina, and that staples the retina in place, if you will. That laser takes about 4 to 6 weeks to form a good scar. So in the meantime, we have to put something in the retina to hold it in place while the laser can form a permanent scar to hold it in place. That something we put in the eye is either a gas bubble or a silicone oil bubble, and that acts like a balloon to physically hold the retina in place until it's healed on its own. The gas bubble is usually what we use first line if it's your first retinal detachment. And that's because the gas bubble slowly goes away on its own. With the gas bubble in the eye, you will likely have to position your head for 2 weeks after the surgery. Depending on where the problem is in the retina, we let you know after surgery how that positioning will be. It can either be upright on either side or face down, or a combination of those depending on where your problem area is in the retina. With the gas bubble in the eye, you cannot go up any altitudes more than 3,000 feet because the gas bubble can expand. That means no traveling to Las Vegas, no traveling up north, no getting on an airplane, anything more than about 3,000 feet. Depending on the strength of gas bubble that we use, that process can be anywhere from about 2 to 3 months. So if you have to travel and it's not something that can be canceled within that first 2 to 3 months after surgery, then the gas bubble is not an option for you. If that's the case, or if the surgeon feels like we need to do something stronger, we can put a silicone oil bubble in the eye, which works just as well as the gas to hold the retina in place. The silicone oil bubble oftentimes does not require any positioning in the postoperative period. However, it does require a second surgery to remove the silicone oil. It does not go away on its own like the gas. Depending on how extensive your retinal detachment is, that silicone oil bubble can stay in anywhere from about 3 to 6 months. With the gas bubble, there is positioning equipment that you can rent, oftentimes covered by insurance, that will help hold your head in the position we'd like for 2 weeks. The positioning equipment is kind of like a massage table that allows you to comfortably rest your head in whatever position we require so that you don't have a sore neck or back at the time of positioning. People always ask what your vision will be like after retinal detachment repair, and this is a very difficult question to answer. The biggest risk after a retinal detachment repair is the chance of a redetachment. 85 to 90% of people just need one surgery, but that means 10 to 15% of people require a second surgery because their retina redetaches. Assuming your retina does not redetach, we have to just get the retina back in position, and then we see what the vision will be like afterwards. Every patient is very different, and we don't know what your vision will be like until we let the retina heal and see what we end up with. The other thing that you have to be aware of is if you have not yet had cataract surgery, doing retinal detachment repair will make the cataract in that eye grow faster. The average for all people after retina detachment repair is about 9 months after retina surgery, you will need cataract surgery. Some people it's a little bit longer, some people it's a little less, but the average for all people is about 9 months. So that's something to be aware of as well. The other more rare risks after retinal detachment repair are bleeding and infection, and those happen less than 1% of the time after repair.